It's time now for County-Wide, a special presentation of Yavapai Broadcasting News. Join Paul David and Brad Miller as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives here in Yavapai County. And now, here's today's County-Wide.
Well, good day and welcome to the program. It is County-Wide. Brad Miller with you, and we're happy to welcome into studio today David McEntee. And we've talked many times with David from the Yavapai County Community Health Services, which from here on out I'm going to say the Health Department.
There you go.
The shorthand for that. But David, good day, and happy to have you come in the studio.
Thanks for having me.
We're going to talk today about the local implementation, local being on the Yavapai County level today, of the Affordable Care Act. Folks going online typically, or trying to. There's been some difficulties with the website, the healthcare.gov, but signing up for, let's call it the ACA from here on out, Obamacare. You think about it as a federal level with all the discourse that's been happening, but it's a local thing. And the counties, many of them in our state and across the United States, the states are kind of approaching it at various levels as to how involved they will be in helping people understand and ultimately sign up for the Affordable Care Act for federal health care program if they need to. And Yavapai County is among those, and David is among those folks within our county who has been trained to help do that. Is that right?
That's correct.
Have I started it correctly?
Absolutely.
Now, let me start. Are you trained as we hear this word navigators.
Right.
Are you a navigator to help people with this, or?
No, there are three levels. There's the navigators, which are the very top. They just do education. There's certified application counselors, which is what we are, that do education as well as assist in enrolling.
Okay.
And then there's agents and brokers, which actually work for agents or insurance companies, and they just do enrollment. So we're kind of in the middle. We do a little bit of both education and enrollment, and I think it's a great place to be. You
talk about education. There have already been and will be more kind of public, what are we calling them, seminars,
We're calling
meetings?
them seminars, yeah.
Seminars, okay.
Yeah.
Where members of the community who are uninsured or perhaps are helping a family member, say, try to get insurance to come and sit down in like an open house type setting.
Absolutely.
Okay.
Little 30-minute seminar where we talk a little bit about what the Affordable Care Act is.
Okay.
Define some terms, marketplace, exchange, Obamacare. What is this? How does it affect me is really what it's all about. Lots of questions, a lot of interaction from the audience, and then we allow them to set up appointments where they can come in and talk to us one-on-one and look at the application process and go through it and just get all their questions answered.
Now, there's been a lot of concern, the launch of the website, and everybody buys things online these days, including healthcare.
Right.
A lot of folks, and as I understand it, demand has been very high and caused a lot of problems with healthcare.gov is the website.
Yes.
And that takes you to the national marketplace.
Right.
Okay.
Right.
I looked this morning, it was there. By this afternoon, who knows?
Right.
So there's been some issues with that. If I don't want to go online for this reason or can't for another reason, what else can I do? What are my other options?
You've got a couple of different options. There is a paper application that you can get and fill out. That's sort of the bottom line. Fill it out, send it in. It takes about 3 weeks to get that determination back, where they'll send you basically saying you are eligible for X. You can do it on the phone. You can call up some of the call centers, which you can get through healthcare.gov or contact us. We'll get you that phone number.
Okay.
Or you can come in and see us. If you don't have internet access or you just don't want to do it online, come in and see us. We'll walk you through that process. The libraries have been very helpful. They've got computers set up, people that have been through a little bit of some basic training that can help you maybe answer some questions. So that's available to you. But really the best thing we believe is just come see us. Give us a call, set up an appointment. We'll set you an hour where we can just sit down and talk to you and walk you through the process, make sure you've got all your questions answered.
It seems to me, from what I'm hearing, the few people I know that have been doing this have been kind of looking online and kind of kicking the tires, so to speak, kind of like looking at the cars online, but then you go and you actually sit down with a handshake and talk to a guy about that's kind of happening. Are you finding that, and is that a good way to do it?
We are, and that's really kind of the analogy that I give is if you go to the car dealer and you see the sticker on the car that says how much you're paying for the tires and the tint and all that stuff, that's what the marketplace is going to do for you, which you can do online by yourself.
Okay.
But some people just don't want to go through that process on their own, so they want to come to us from the very get-go, and that's fine. Or if you get to a certain point where you just don't know, you save it, you create an account online and you start the application and you get to a point where you just don't know, then you come and see us and we pick up exactly where you stopped off and we help you through the rest of that application.
Okay.
So yeah, and that's really the best way to do it, is just get a feel for what you can do. And if you just know you can't do it at all, just give us a call. There's no obligation, there's no cost.
Right.
We don't, you don't have to sign up for anything. You can go through the entire process and go, and walk away.
Right.
No problem.
Right. This is you talked about at the presentations, and maybe I can get you to do kind of a mini presentation for us today. But one of the things that you do is kind of define some of these terms, and I'd like to ask you about that. Marketplace, the word we've used quite a bit already in the program. In essence, that means, to me, it sounds like it's a place where I can do some comparative shopping.
Right.
Is that how this works?
That's exactly what it is. There is, in essence, two systems, and unfortunately there's two systems, but there's the marketplace, which is where you will go get private insurance, and that's the bottom line, is what it is you're looking at private insurance, apples to apples comparison. Company A, Company B offers this, and this, this much of a deductible, and yada, 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 all the way down the lines, apples to apples. There's also access. Those people who are eligible for access because their income is at a certain level, they may be eligible for access. We can take them through that process as well. And what we do is, the very beginning, when you walk in, we're going to ask you, first of all, do we have your permission to run you through this application? And then they say yes. And then we say, how much do you make and how many kids do you have? And then we kind of use a chart, very simple chart that says, okay, we believe you are eligible for access, or no, you're eligible for the marketplace insurance with some of these tax incentives, or no, you're just going to have to go out and buy yourself insurance. And so that's where we kind of start, because that way we know which system to start you in. The average person doesn't have access to the access system. It's called HEA Plus, Healthy Arizona Plus.
Okay.
But most people have access to the marketplace. So you can start that process and go through the marketplace, or what used to be called the exchange, it's now called the marketplace,
okay,
and start the application yourself. So it's a little bit confusing, but that's kind of the general basis. It's sort of a two-tower system, if you will,
gotcha,
that most people have access to half of that.
Now, I hear about subsidies.
Yes.
Is that what you're talking about with the access piece of this, or is that something else?
If you're eligible for access, access is access. There's no cost. It's just
access is a state program in Arizona.
Yes.
That's been here for as long as I can remember.
Right.
This is not new.
No, the new thing is the expanded eligibility. A couple of years back, they in essence kicked off everybody that didn't have children, the childless adults.
Right.
Those people are now eligible again because of the expansion that the federal government has allowed. And so that's who we're really going after, because we know that these people still need insurance. Just because they don't have kids doesn't mean they can afford something else. And we're running them through the access application process.
Okay.
But no, the subsidies is on the marketplace. So let's say you make too much money for access. We're going to see what you're eligible for in the marketplace. Excuse me. But you might be able to get a tax deduction, basically, which is what it is, to reduce your monthly premium. So that
gotcha,
$200 you pay a month for insurance, they might be able to knock down to $100. And these are just numbers we're just making up.
Yeah, it'll. I'm sure there's a lot of formulas, a lot of different things to kind of factor into that.
Yeah, but those are the subsidies.
Okay, so the subsidies may kick in, and that's the kind of thing, here again, you'll walk me through.
Right.
Will I find that piece of it? Because it's going to be important to a lot of people, it seems to me, if I'm going strictly online, I assume.
Yes.
Okay.
Yes. Yeah, once you go through the application, put in your name, address, telephone number, income, number of dependents, it's going to say, okay, because we've verified your information and that's accurate, we say that you are eligible for this, these insurances and this tax incentive.
As I understand, there's a silver, a gold, a bronze, and so on. As if those are shorthand, or if those are the okay. Yeah. I want to talk a little bit about that when we come back. Okay. David McAtee is with Yavapai County Community Health Services, the health department in Yavapai County. It's healthcare.gov. You can also look at the county's website for more information. We'll talk more with David when we come back to Countywide right after this.
Listen now, can you hear the bluebirds? Oh, look up now, can you feel the sun?
All right. I know this isn't any fun to talk about, but we should. Okay. So who's going to do what?
I'll pack the dead batteries.
Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice.
And I'll try to get the generator going without any gas.
Oh, let's not forget the cell phones, which probably won't work.
Right.
And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
Well, I think we couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
We welcome you back to the program. It is Countywide. Brad Miller with you and our guest today, David McAtee, Yavapai County Community Health Services, and we are talking about the implementation of Obamacare, the Affordable Care Act. Healthcare.gov, the direct line, you can go there and do all the things David was talking about in our first segment towards securing health insurance for you and or your family. Can we do kind of a walkthrough?
Sure.
Let's say here comes Joe Q. Public,
Right.
Brad.
Right.
Year-old chubby fellow, but I'm going to be asked if, and let's say I'm going to go to the website. It seems to me a good many people are certainly appear to be trying to do that.
Yes.
I'm probably going to be asked. I'm assuming I'm going to be asked the same questions I'd be asked if I went to a private insurer before this ever took effect. And wanted to secure health insurance. It's the same thing, or is it?
It's actually a little simpler. We've been through the application process, and it's a pretty straightforward. The paper application is 3 pages, if that tells you anything at all. Name, address, telephone number, age. The greatest thing about this whole thing, no matter where you fall politically, is that the insurance companies cannot charge you more or exclude you for a pre-existing condition. And I make this joke kind of hesitantly, but women, you have a pre-existing condition. Being a woman, you got charged more for your insurance.
Yeah.
They can't do that with the marketplace.
Right.
So, in a sense, that's one of the great things that comes out of this is that just because you are what you are,
Right.
they cannot charge you more. They also can't cap you. Let's say you've got extensive medical conditions that continue to go up and up and up in expense. Some insurance policies say a $2 million cap. At that point, we cut you off. We're not paying anything more.
Right.
They can't do that anymore either.
Right.
And that's across the board. That's not just the marketplace. That's any
That's
insurance.
been in place for a while.
That's actually just coming on board January 1.
Oh, okay.
That's
I'm
effective
understanding.
January 1, that the insurance companies cannot charge you more because of a pre-existing condition or have a payment cap, in essence.
Okay, gotcha.
That's something brand new that's coming out of this Affordable Care Act.
And as you go to the marketplace, if you do, if that's the way you go, all of those will be in play as
Correct.
you sign up to start.
So some of the questions they're going to ask, and this is really where I was going, is they're not going to ask you, do you have a pre-existing condition? Because it doesn't really make an effect.
Right.
Now, they may say, do you have a specialty that you're looking for? Because they're going to present you with insurance companies that have doctors that cover that specialty. So that's where it kind of gets in a little bit of a confusing issue, but really it's actually a simplified application because
Meaning, say I have asthma.
right.
Is that what you're talking about?
Yeah,
Where
they're not
you
going
can
to
be steered toward a plan that will
Correct.
best address.
Yeah, or diabetes. If you want a
Okay.
specific diabetes doctor, they're going to say, well, these are the doctors that in this insurance company, and when it presents you with your options, this
Gotcha.
insurance company has this doctor in its policy that is a specific doctor for diabetes.
So when I go online and I start inputting all this information, it sounds like it all just kind of takes and kind of
Yeah.
funnels into what is going to end up being the best
Best for
options
you,
for me.
right,
Okay.
yeah.
At the end of the day, it's all going to come down to cost.
Right.
And sometimes versus coverage. If I want the Whammo Jammo, the Cadillac,
The Platinum.
I'm going to pay this, the Platinum.
The Platinum version.
If I want the 68 Volkswagen Bug, I'm going to pay this
Bronze.
and get this.
Correct.
Is that right? Is
Yes,
that,
absolutely.
Okay.
There's 4 levels: bronze, silver, gold, platinum. Bronze being your least expensive, but also covering the less. So it's a 60-40 split. You pay 40%, the insurance companies pay 60%. Platinum being the most expensive, they're going to pay 90%, you pay 10%. So depending on how much you can afford and how much insurance you need, again, it's all there for you. Company A, their platinum is this much. Company B, their platinum is this much. And you go, well, this has got the doctor I want. It's a little more expensive, but I'm going to go with this direction. And then you just click that and you're on your way.
Okay. There's deadlines attached to all of this.
Right.
What what do I need to get online today and take care of this? Or?
Not necessarily. In fact, I would wait probably another week or so, just because right now the website is just being hammered. Everybody in the nation is going to this website, and they're adding servers as quickly as they can to accommodate for this increased demand. But I would wait, honestly. Give it a week or two, let the demand kind of slow down. But basically, you have until March 31st to get a policy.
Okay.
Now,
see, I thought it was January 1.
January 1, this all starts. But the open enrollment period, just like any insurance company, or if you work for a company and there's an open enrollment period, that ends March 31st.
Okay.
So you have to have something in place by that point, or you have to wait until October of next year to start looking, unless there's some life changing. You get married, you get divorced, you have a kid, you lose a kid, that kind of thing. That'll allow you to come back into the marketplace.
Okay.
But basically, you've got to have something in place by March 31st, which means really March 15th, you have to have made a decision, picked a plan, and made a payment so that it starts, by the end of March.
Okay, and if you don't do that, then we get into the fine and all that.
Yeah, exactly.
That's not really health related. Maybe that's something we can talk about at another point. Okay. I think what we're trying to do today is inform everybody how this works, so that you understand it. You touched on something I want to go back to. If there is an alteration to the plan, someone either gets dropped, or added that was unforeseen, say at this point, you're signing up today or this week or next, and come February, there's a big change. Do we know the difficulty in doing that, or? It's
very simple. You'll go back to the same website, log in with your same information, and just say, I need to make this change. That's one way to do it. You can also just go directly to the insurance company. Let's say you get insurance through the marketplace. So you're not on Access. You're in private insurance that you purchased through the marketplace. You go and let's say it, picked company A. You can either go back to the marketplace website or go back to the company's website and just say, I need to make this change. And as long as you're in their system, you're fine. And as long as it's a life-changing event. You can't just say, I want to create a new policy, if you will, without being in the system already.
Okay, that's what I want to get to. It seems to me, in other things in the market, as all of this kind of aggregates through, there might be some cost adjustments between the different players that are in on this. And I know some of the big dogs are sitting on the sideline kind of waiting to see how this goes. Others have jumped in full, completely. But it sounds like that's not really going to be how this is going to work. In other words, if I sign up next week and I like Fred's insurance, and that's what my family and then over here, a friend tells me, well, Sally's has given me better coverage for a lesser, I can't just go in and start to swim those waters.
No, I think once you're in with a company, you can drop the insurance entirely and just say, I don't want anything, and walk away. But you can't switch companies per se.
Okay.
You can make changes throughout the year, and again, like I said, you can drop it. But once you're in, you're pretty much there.
Okay.
As far as costs go, we don't know. We don't know how much those are going to cost, because it's going to be different for, depending on your situation and how many people you got in your family and so on and so forth. But yeah, there are going to be some options, and you're going to have to just pick one.
When we see these costs, and they're I think just kind of based on a 25-year-old single healthy young man is going to certainly be different than a aged chubby fellow, right? And so those, just like any other kind of health insurance plan, all of those are going to be into play. Because I keep having people ask me, how much is it?
Right.
Or what's this? And it's like, well, it's going to depend on it's very specific information.
There are some variables, obviously, yes.
Okay.
But what they can't do is they can't charge you more because you've got diabetes than me, who doesn't have diabetes.
Right.
But yeah, age groups,
those kinds of things are still in play.
Right.
Okay.
Yeah.
Let's take another short break. We need to pause. David McAtee is with Yavapai County Community Health Services, talking about the county's involvement in the implementation of Obamacare, the health care initiative. We'll take a break. We'll be back after this.
So who's going to do what?
I'll pack the dead batteries.
Great.
I'll only put what I don't need into a duffel bag.
Perfect. That's totally unhelpful.
No problem.
Meanwhile, I will try to comfort everyone by speaking in a calm voice. And who is going to handle supplies?
I can forget to do a list for us.
Thanks, pal.
We couldn't be any less prepared. I'm proud of you guys.
Talk to your kids about who to call, where to meet, what to pack. Visit ready.gov/kids for tips and information.
I'm one on Bookie Guide. The chance of being involved in a robbery is 1 in 757. The chances of being struck by lightning, 1 in 750,000.
Please fasten your seatbelts for unexpected turbulence.
The chances of being a victim in an airline crash, 1 in 29 million. Hey, could I get some peanuts? The chances of being involved in a car crash are far greater than lightning strikes and plane crashes. And if you are texting while driving, your risk of crash increases 23 times. Now, I may be an unlucky guy, but I don't have to be part of that statistic, and neither do you. Drive responsibly.
There's no place like home.
Getting home safely is just a click away. But making sure your child is in the right seat is just one of the steps down the road to safer travels.
I don't know how it works.
Find the right seat for your little one's age and size.
We've done what you told us.
There's no better way to get home safely. Know for sure that your child is in the right seat. Get all the facts at safercar.gov/the right seat. Brought to you by the National Highway Traffic Safety Administration and the Ad Council.
Again, welcome back to the program. David McAtee, Yavapai County Health Department, is here. Healthcare.gov, also the county's website.
YavapaiHealth.com.
YavapaiHealth.com. You'll find a lot of information, including info about the seminars, the public meetings about this initiative. You can go and sit with David or other representatives from the health department and talk about this, what it is, what it isn't, how you do it. They'll walk you right on through it and get information. It's the best way to kind of proceed. There is a lot of confusion over anything new. Right. Certainly, this is a whole new ball game, and a lot of people do have questions. There's a penalty.
Yes.
If I don't, by the time frames you've talked about earlier in the show, sign up at all, right, I'm going to get a fine, basically.
Yeah, the bottom line is if you don't have insurance for 9 months out of 2014, so 9 months out of next year, right, there will be a penalty that you'll see in your 2014 taxes that you file in 2015. Okay. So basically, if you don't have insurance for next year, you will see it in a little penalty. It's about $95 per adult in your taxes that you'll actually pay April 2015. Okay. So the first year it's about $95 per adult. The following year it goes up to $325, and the following year it goes up to about $900 per adult.
Yowza.
So that's where we really got to worry about, how much are we going to pay for insurance versus the penalty. Right. But really, we don't want anybody to pay a penalty. And if you're eligible for access or insurance with these subsidies, wouldn't you rather have insurance than pay a penalty, even if it's a small one? Right. And that's really all we're doing, is we're just trying to get people educated as to their options. Let them know how to avoid this penalty.
Yeah, the number I heard was roughly 15% of Americans are the ones who are going to be doing this. I have been asked, and I've heard it said repeatedly, it sounds silly to me, and perhaps to you too, David, that I've talked with more than a handful of people who think that they have insurance with their company, say, through work, like a lot of us do, that they have to stop taking that and sign up for this.
Yeah, no, if you have insurance of any kind, even if it's through the VA, Medicaid, Medicare, any of that stuff, any insurance at all, you're good, and you don't have to do anything at all. You can just completely ignore this whole conversation.
Right. It isn't about signing up for Obamacare. No. It's about having health insurance
correct,
in whatever legitimate form that may take.
Well, and that even includes some of the like Medishare, the Christian Medicare, that kind of stuff. Right. That's included. That works. Right. So
be informed. That's what the folks at the county are trying to convey. And there's a lot of ways to do that. Healthcare.gov, if you want to sign up and go take a look at what that's about. Through the county's website, more information. And perhaps the best are the seminars, the series of public meetings that the county has been having and will continue to have. And you can find a roster of those dates and times on their website, again, at
YavapaiHealth.com, and look for the Affordable Care tab at the top.
Very good. David McAtee, Yavapai County Community Health Services. Thank you, sir.
Thank you for having me.
Always educational. We'll take a break until next time. Thanks for joining us. It's Countywide.
This has been Countywide, a special presentation of Yavapai Broadcasting News. Listen in each Tuesday and Thursday as we tackle the hot topics and talk to the decision makers across Yavapai County. That's Countywide with Brad Miller and Paul David each Tuesday and Thursday on this Yavapai Broadcasting station.